Hello everyone, my name is Christopher. I'm an intern here at the Human Rights Measurement Initiative, and today I'm going to give you a short demonstration on our rights tracker, looking particularly at the people at risk section, particularly looking at older people. You're more than welcome to follow along with me if you go to your search engine and you type rightstracker.org in, and you can also explore our web pages within the 5 specified languages here. Our rights tracker is our main tool for measuring the human rights performances of countries, and we can explore those scores across the rights themselves and people. We currently explore 13 different rights, and we have 39 people groups where we can explore who is at particular risk of rights violations across our 13 rights. So we're going to have a look at our country today, in particular to older people, and we're going to look at Nepal. So you'll type in the search box Nepal, and when you do that and go enter, it will bring you up to the Nepal page. And here we have an at a glance section where we first land. This will show us the summary statistics of the 13 rights, which are split up into 3 different sections. So we have our quality of life rights, which encompass our economic and social rights that we measure. We have our safety from state and empowerment rights, which covers our civil and political rights that we measure. And then underneath, we also have some summary statistics about scores, and also when we compare Nepal to other countries within the region that it is in, based on its income adjusted benchmark, which is South Asia. We won't go into too much detail today, but on our YouTube channel and within our main page of the Human Rights Measurement Initiative, there are video tutorials which goes into more detail about these 3 tabs and about the scores. But we're going to look at the people at risk tab. Now, the people at risk tab, how we go about collecting data for this is that we conduct expert surveys yearly, which are done discreetly. And the experts are people that work within the human rights space that are journalists, NGO members, and lawyers who either work within particular rights and are experts in those fields, or very broadly work across all the human rights categories. This allows us to ascertain the situation that is occurring within these countries, as it's very hard for us to actually say what's going on with those countries if we're not already within the country observing what's occurring and actually working within the field of human rights in this country. So here we can actually highlight for our group, and we're going to highlight older people. Once we've done this, within the word clouds that appear underneath the right, older people, where it appears, will be highlighted. So we're going to go to the right to health. So at the right to health, we can see older people has been highlighted. And from the human rights experts we have surveyed, in particular to the right to health, 38% of them have identified older people as being at risk of having this right violated. It's important that this overall is showing which particular groups are at risk, but particular groups are not at more risk than other groups. This is basically saying from experts' opinions and what they have seen and what they currently work with, is that they've seen that these groups, these groups are on the particular surveillance mind, or they work closely with these groups and they've seen that these groups are at particular risk. But it doesn't necessarily mean that older people, that they're at less risk than people with low social economic status being at risk. We also ask our survey respondents to provide more context about who was particularly unlikely to enjoy their right to health in 2020. And they've listed a few things below. First off, they've said that everyone was at risk due to COVID-19. So regardless of what these people groups are that we've specified, many of them have said that everyone was at risk due to COVID-19 for having the right to health violated. People with common health needs were also at risk of having this right violated due to COVID-19, in particular those needing maternal and elderly people, and also people in certain locations and regions. So regardless of what is seen here, there could be people that have certain common health needs that fit in with the people with low social economic status. So this is applying a more blanket coverage of what type of people are actually being affected. And also geographically, if people live within those areas, they're more likely to have these rights violated in particular. Now, while we can look at countries, we can actually more broadly see the countries where people that are older suffer greatly or have high risk, particularly of having the rights violated. So if we go to all groups, we have our 39 at-risk groups. We can scroll down to older people and click in. When we click in, this will show us where older people are at extra risk of at least some violations in the following countries. And these are the countries here. We're split across sub-regions. And we can see these countries. These countries are the countries where older people in particular appear more frequently within the survey. Now, it doesn't mean that countries that are not specified don't necessarily have older people having their rights violated. It's only based upon what we can survey at the time from our survey respondents. That is everything for today on our People at Risk section, looking at older people. You're more than welcome to go to our YouTube channel where there'll be other demonstrations in regards to older people and using our data. You can also download the data sets at any time, and you can go to our People at Risk section where you can see the number of respondents and the counts of people who counted older people or any other group as being at particular risk. Have a very great day, and it was a pleasure showing you the Rights Tracker.